good. How are you?
I'm pretty good. My name is Mandy. I am going to be the nurse that is doing your physical assessment today. Let me just come over here and close these blinds, give you a little privacy here. I see you're already covered up. Now, I've already assessed your age versus your appearance, and I've looked at your grooming habits and your nutritional status. I've taken your vital signs, assessed your pain level, taken into account your position and your posture. I've assessed your mental status, looking at your eye contact and your facial expressions and your speech and your affect. Can you tell me your name and your birthday?
Kelly, March 5th, 1992.
Good. Now I'm going to begin the assessment by looking at your skin. I'm going to be continuing my skin assessment throughout the whole exam, but first things first, I'm going to look at your hands and your nails, looking at the color, the vascularity of it, noting any obvious lesions. I'm going to check the skin turgor, going to note the temperature, the moisture, the texture of your skin. It seems good. I'm just going to cover you back up there. Next, I'm going to move to your head. I'm going to assess the shape and the size of your head, making sure everything is symmetrical and good there. I'm going to look at the hair distribution, the hair texture. I am going to look for any lumps or bumps, any obvious lesions. I'm looking at the hair texture as well as the scalp texture, noting any infestations or any scaliness or tenderness. Do you feel any tenderness when I push on your scalp? Good. Okay. Next, I'm going to look at your eyes. Can I get you to remove your eyeglasses for me, please? Thank you. I'm going to assess your eyebrows, your eyelids, and your eyelashes, looking at the general position of your facial features, starting with your eyes. I'm going to look at your pupils, your sclera, your conjunctiva, your lacrimal sacs, and your glands surrounding your eyes. I'm going to look at your cornea and all of that. Let me get some gloves on. I'm just going to pull your eyelids in a little bit, noting any redness, swelling. They look good. I'm going to feel for your sinuses. Those feel good too. I'm going to look at the structure of your nose, noting the alignment and the symmetry, looking for any deformities in your nose. Next, I am going to take my pen light. I'm going to shine a light in your eyes. I want you to look at my nose, bright light to your eye. I'm going to test your pupils, make sure that they are constricting well. Next, I want you to look at the tip of my pen light and follow it with your eyes only. Now I want you to look at the tip of my pen light and then look at something behind me. I'm making sure that your pupils work well. Next, I'm going to look at your ears, noting the shape and the size of your auricle, your tragus, and your lobes, making sure there are no bumps, no lumps, there's no swelling or drainage from each of them. Is there any tenderness when
No.
touched? Okay. Now I'm going to perform a test on you. I'm going to close your ear. I'm going to whisper something into your ear, and I want you to repeat it back to me, okay?
Lizard. Banana.
Okay. Now I'm going to perform a test on your nose where I close one ear, and I want you to blow out, okay? Good. Good, good, good. Next, I'm going to look at your mouth. I'm going to assess your lips and the inside of your mouth. Can I get you to open your mouth and say ah? Alright. Say it, John. Good. Alright, I'm looking at your mucosa. I'm looking at your gums. I'm looking at your teeth, the distribution, the integrity of the teeth. I'm looking at the tongue and the uvula when you say ah, and your tonsils, the shape and the size, and the pharynx back there. Next, I am going to have you stick out your tongue for me. Good. Now I'm just going to inspect your tongue, make sure there's no bumps or lumps, looking at the color, the moisture level, and the texture of your tongue. Sorry. Next, I am going to assess your face. I want you to smile for me. Good. Now puff out your cheeks. All right, and raise your eyebrows. Good. Now I have already assessed your facial features, making sure everything is symmetrical and proportion to each other. Now I'm going to do the cotton ball test. I want you to close your eyes and tell me when you feel them touch you.
Now. 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 Now.
Good. Now I am going to do the sharp and the dull test on you. Now this is sharp and that is dull. I want you to tell me whether or not you think it is sharp or dull when I touch you.
Sharp. Dull. 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 Sharp. Sharp.
Good. Good. Now I am going to assess your neck, looking at the symmetry of it. Make sure there's no swelling there, and there is none. All right. Now I'm going to have you take a sip of water while I palpate your thyroid. Make sure everything moves smoothly. Good. And it moves well. Now I am going to look at your lymph nodes. Pre-auricle, post-auricle, occipital, the tonsillar, submandibular, submental, looking at the cervical chains, supraclavicular, infraclavicular. I'm going to do your axillary. There's 4 under your armpit, so it may take a little. All right, can I get you to lean back just a tad? I'm going to do your inguinal. Can I get you to turn around for me, please? I'm now going to assess the skin of your back. I'm going to look at the contour of your back, noting any deformities and whatnot, making sure that the respiratory pattern and the rhythm is equal on both sides. Can I take you to take a deep breath? Good. Now I'm going to palpate for any lumps or bumps, any abnormalities. Good. Now I'm going to percuss. Now, I am going to listen to your lungs, and I want you to let me know if you feel dizzy at any point. In that case, I will stop the assessment. Take a deep breath. this arm for me just a little bit. Okay. Good. Now, while I have you turn around, I am going to note the spinal process and make sure that there are no deformities with your spine. That have you already? Good. All right. Now, can I get you to turn around for me? All right. I'm going to do the same thing for the front. I'm going to note the skin color, the texture, the moisture level, and I'm going to make sure that the contour looks good, that there's no accessory muscles being used when you breathe. Can I get you to take a deep breath? Good. Making sure that it's symmetrical when you breathe, noting the diameter and it's normal and everything. Now I will palpate, looking for any lumps or bumps. And we are deferring the breast and knee. Assessment. And again, I'm going to have you take deep breaths. When my stethoscope touches you, let me know if you feel short of breath at all or dizzy. Now I am going to be looking at your chest, looking for any pulsations from your heart, looking for anything abnormal there. I am going to find your apical pulse. And compare it. Good. All right, now I'm going to listen to your heart. Now I'm going to do it again, but a different part of the stethoscope. Your heart sounds good. Next, I will assess your extremities. I will look at the color of your arms and your legs. I'm going to check your capillary refill, noting any clubbing that's going on, looking for any edema in arms or your legs. Now I will check your pulses. All right, Can you should lean back just a tad. Alright, now I'm going to check your pulses on your feet. Good. Alright, can I get you to lay down for me, please? Alright, I'm now going to inspect your abdomen. I am going to make sure that it is symmetrical. I am looking at the contour and the shape of it, looking at any scars, and you know you do have some scars. Looking for any distension or any abnormalities of your stomach and the skin temperature, which is good. Now I'm going to listen to your bowel sounds. You have very active bowel sounds. Now I'm going to percuss. Good. And I've already noted your umbilicus. You have a piercing there. I'm now going to palpate softly. A light palpation. There's no distension, so this didn't hurt. Now I'm going to do deep palpation. Alright, do you feel any tenderness?
No.
Can you just sit back up for me, please? Cover you up here, keep you warm. Alright, next I'm going to look at your joints, starting with your neck. I'm looking for any crepitus, any swelling, any warmth, any pain. Shrug your shoulders. Good. Turn your face. Turn your face. Good. Now, move your arms up. Good. Range of motion with your shoulders. Now your elbows. Sorry. Good. I'm going to look at your wrists and your fingers. Looking at the joints, making sure there's no swelling. Everything's good. Everything's okay. You don't have any pain, do you?
No.
Alright. Now I'm going to assess your hips and the range of motion for them. So I want you to, oh, good. And again. And your legs, I want you to kick them out. Good job. There's no warmth or swelling. Now I am looking at your ankles, making sure they move okay. And I'm looking at your toes, which are very cold. Cover you up just for a second because I'm going to test your deep tendon reflexes. I want you to relax your arm for me. Soft liquor. I'm going to do the patellar. All right, now I'm going to assess your gait. So I'm going to have you stand up for me, please. And walk that way and walk back. Good. All right, can I get you to stand? What I want you to do is grab my fingers, squeeze them as hard as you can. Good. Now I want you to put your arms at your side and close your eyes for me. I'm going to make sure you don't fall because it's going to be a couple seconds that I have to stay on this. Keep your eyes shut. I'm noting any deviation, swaying. You're good. All right. Now you can back up a little if you want. Put your arms out in front of you. Your palms up. Close your eyes. Good. I'm looking for any deviation of your palms when I do that. Can I get you to put the heel of this leg and run it down your shin? There you go. Do it to the other leg. There you go. Good job. All right. I think we are done with this assessment.